Imagine taking a small purple pill every morning for heartburn. It works. You feel better. So you keep taking it. Months turn into years. And then you find out it may have been quietly damaging your kidneys, weakening your bones, or increasing your long-term cancer risk. That pill is a proton pump inhibitor. Medications like omeprazole, esomeprazole, and pantoprazole are prescribed over 100 million times every year worldwide. Millions more people buy them over the counter. They are extremely effective. But here's the truth most people never hear. Stomach acid is not the enemy, and long-term acid suppression comes with real risks that are still widely overlooked. If you've been taking a proton pump inhibitor daily for months or years, this video matters. I've helped dozens of patients taper off these medications safely, often reversing symptoms and feeling better than they have in years. Today I'm going to walk you through the latest science, the real risks confirmed in 2024 and 2025 research, and evidence-based ways to manage reflux without unnecessary long-term harm. Let's start with what proton pump inhibitors actually do. Why acid matters. Your stomach is supposed to be acidic, very acidic. A normal stomach pH ranges from about 1.5 to 3.5. That acid kills pathogens, it triggers digestion, and it allows your body to absorb critical nutrients like calcium, magnesium, iron, and vitamin B12. Proton pump inhibitors shut down acid production at the source. That can be helpful short-term, especially for ulcers or severe esophagitis. But when used long-term for mild reflux, you're disabling a normal defense system, and that's where problems begin. Let's talk about the biggest risk, kidneys. This is the one that worries me the most clinically. Large studies published in late 2024 followed more than 120,000 long-term proton pump inhibitor users. They showed a clear association with declining kidney function and higher rates of chronic kidney disease. Earlier reviews involving hundreds of thousands of patients showed a 26 to 34% higher risk compared to people not taking these drugs or using alternative acid blockers. Here's the scary part. More than half of people who develop kidney damage from proton pump inhibitors have no warning symptoms, no pain, no early signs. The damage is silent until it's advanced. The mechanisms are well understood. Low-grade inflammation in the kidneys and chronic magnesium depletion both play a role. Pause for a second and ask yourself this. Has your kidney function ever been checked while you've been on a proton pump inhibitor? Now, the one people fear most, stomach cancer. Before we go further, an important clarification. Proton pump inhibitors do not directly cause stomach cancer, but they can increase risk in specific situations, especially after a prior Helicobacter pylori infection. A landmark study from Hong Kong followed over 63,000 patients after bacterial eradication therapy. Those who stayed on long-term proton pump inhibitors had more than double the risk of stomach cancer. After 3 years, the risk increased even further. Recent reviews in 2025 confirm this association, particularly in people with damaged stomach linings. Low acid allows harmful bacteria to thrive and produce compounds that promote inflammation and cellular damage. That's why many modern guidelines recommend switching to alternative medications if acid suppression is still needed after treatment. Bones and nutrient deficiencies. This part often gets missed. Large analyses published in 2024 confirmed dose-dependent increases in fractures of the hip, spine, and wrist. In some groups, fracture risk was 50% higher. The warning from the Food and Drug Administration still stands. Without adequate acid, calcium absorption drops. And it's not just calcium. I've personally seen patients come in with muscle cramps, fatigue, or heart rhythm issues. Lab work later showed severe magnesium or vitamin B12 deficiency after years on these medications. Iron deficiency and anemia are also common. These problems build quietly over time. The good news, this is fixable. This is the empowering part. You can come off proton pump inhibitors safely when it's appropriate, but you should never stop them suddenly. Rebound acid production can be intense and uncomfortable, but it is temporary and not dangerous when managed correctly. Current guidelines from North American and Canadian medical organizations recommend gradual tapering once symptoms are controlled, usually after 4 to 8 weeks. A common approach looks like this. Full dose every other day for 1 to 2 weeks, then half dose daily for another 2 weeks, then on-demand use or discontinuation. During this time, medications like famotidine or simple antacids can be used for breakthrough symptoms. This is not about suffering. It's about retraining your system. What actually helps long-term lifestyle changes have the strongest evidence. Losing just 10% of body weight can dramatically reduce reflux symptoms. Eat smaller meals. Avoid lying down for 2 to 3 hours after eating. Elevate the head of the bed 6 to 8 inches. Reduce trigger foods like fried foods, chocolate, caffeine, alcohol, and spicy meals. Add gentler options like oatmeal, bananas, ginger, and decolorized aloe. Natural supports with evidence. Think in categories. First, gut balance. Certain probiotics help restore normal gut flora disrupted by acid suppression. Second, mucosal protection. Deglycyrrhizinated licorice, slippery elm, and marshmallow root form a soothing barrier. Third, motility and reflux control. Ginger tea, alginate raft-forming agents, and chewing gum after meals improve clearance. Fourth, nervous system regulation. Melatonin and stress reduction techniques improve reflux sensitivity through the brain-gut axis. This is an alternative versus conventional medicine. This is using the right tool at the right time. Bottom line, proton pump inhibitors are powerful and useful medications when used correctly, short-term, for the right reasons, but long-term unnecessary use carries risks that are now clearly supported by evidence. You deserve better than autopilot prescriptions. Be your own advocate. Ask your provider, do I still need this dose? Can we taper safely? Are there alternatives? Thousands of people have successfully deprescribed these medications. You absolutely can too. If this helped you understand your body better, hit like and subscribe. I share evidence-based health guidance like this regularly, and comment below. How long have you been on a proton pump inhibitor? Any side effects? Are you thinking about tapering? I read and reply to everyone. Thanks for watching. Here's to healing naturally